Hello, I'm Conor Smith, CEO of First Call Computer Solutions, a Montana IT cybersecurity and compliance provider. Who knows what Title 45 CFR Part 164 Subpart C in the Code of Federal Regulations says? It says your hospital should be the beacon of trust in your community. It says this isn't just about checking boxes so regulators don't penalize you. This is about trust. People come to your hospital believing that their personal health information is safe and that the hospital operations will be there while they're being cared for. Is there an opportunity to make your hospital a further beacon of trust in your community? I know cybersecurity can feel overwhelming, especially with HIPAA's increased emphasis on protecting patient data and hospital systems from rising cyber threats. The frequency, speed, and sophistication of cyber attacks on healthcare facilities has increased dramatically. Title 45 CFR Part 164 Subpart C says your hospital must become a beacon of trust in your community now more than ever. It also outlines how to make this happen. When you begin to read all the regulations, it can become pretty confusing pretty quickly about how, so I've simplified it here. Basically, it boils down to these core fundamentals. You need a game plan. The directors and board members need to be involved. You've got to know what you're up against, what the holes are, and fix them. Lock the doors, physically and digitally, and beyond locking the doors, detect, mitigate, respond, and recover. Vendors represent risk, got to manage them. Humans screw up, got to train them. Test it like you mean it. Get outside audits from firms that care, listen to them, fix what isn't working. Report up the chain what's working, what's not, and what's next. Be in front of the regulators. In other words, establish a security program. My ask of you today is to listen and see if I can't better show you how. To try and illustrate this better and make it as understandable as possible, I've turned this into a game to make it a little bit more fun. You can see the starting place, and then it goes to attacks. Attacks are happening all the time. Think of it as just constant knocks at the door. We have to prevent all those attacks from getting in, but sometimes they do, and you either detect them or you don't. If you detect them, you can mitigate preventing them from doing damage. But if you don't detect them, you can't mitigate, and that's where the damage or boom occurs. Once damage is inflicted, you can respond and recover. How well you do that will determine if you're a beacon of trust, or in the worst case, if it's game over. The objective is simple: keep attackers from making it all the way to the game over space. Attacks are like dice rolls that happen every single turn, but in this game, you can't stop your opponent from rolling lots of dice all the time. With these attacks happening all the time, the ideal outcome is for us to be able to prevent the attacks from being successful. Again, none of us can prevent the attacks from happening because they're going to happen, but we can prevent them from being successful in their goal by using various shields like firewalls or multi-factor authentication. If there was perfect prevention, hospitals wouldn't need a security program, but because you can't prevent every attack from being successful, you need to be able to detect. Ideally, if an attack is successful, we would be able to detect if that happened. If we're able to detect it, we have a chance to mitigate it. Let's say someone successfully logged into your account from Tahiti. Ideally, we would be able to detect that that's an unusual login location and then mitigate any damage by either a person or automated system being kicked in to disable your account, change your password, block access, that sort of thing. But maybe you didn't detect, and thus you didn't mitigate. In those cases, we have the dreaded boom. Boom is a military term that is used in cybersecurity to describe an event where damage has been inflicted. How much damage depends on the size of the boom. There are little booms and big booms. There's all kinds of stuff that can happen. So we didn't detect, we didn't mitigate, we got a boom, and now we have somebody in our environment who's doing damage. Now we have the opportunity to respond. The new HIPAA regulations say that when we respond, we must use an incident response plan that we have practiced and understood and are able to jump into action quickly so we don't end up with as much damage as what's depicted here. Once the response is initiated, there are a number of things that happen in order to identify, get a scope, start restoring integrity of the environment. After the response, we move on to the recover stage where everything is fully patched, access is secured, we understand what happened, we understand how it happened, and we improve it. I'm oversimplifying here, especially in a regulated hospital, but I want to illustrate that a security program both addresses what happens before a boom happens and what happens after a boom, big or small. This is the game we are playing. We want to avoid attacks, undetected attacks, booms, and poor responses or recoveries when they occur. Just like in any board game, strategy matters. Most players invest heavily in prevention at the start, which is great, but overlooking the other phases is a bad move. Attacks are inevitable. How you detect, mitigate, respond, and recover often determines whether you stay in the game or end up knocked out. This is why the federal government is pushing hospitals to establish a true security program versus a prevention program. At its most simple level, a security program is the people, the processes, and the tools that get you the outcomes that you want. Here's what that means. You have to have people, specifically the leaders in the hospital, need to be involved in part of the risk management team. You need a chief information security officer, someone who is championing risk management. This can be a fractionalized person in or outside the organization. A SOC, or Security Operations Center, is a team of people, eyes in the sky, monitoring, detecting, and responding. Auditing, do auditing internally to be ahead of the regulators. Work with the regulators through their exams. Find a good third-party assessor and audit again. There's a lot of processes and then unique tools that the security team needs to do their job 24/7, 365. These people, processes, and tools, both inside and outside your organization, all come together to make a security program. Don't assume because you have an IT department or an IT managed service provider that you have a security program. You don't have one unless you have these people, processes, and tools. The HIPAA security rule that we're all familiar with has some proposed changes. I've simplified it here. Mandatory security controls. No longer are we going to have optional. More security controls. Comprehensive risk assessments, vulnerability scans, pen tests. This is the auditing that I'm referring to. Enhanced incident response and reporting. Again, the government is emphasizing hospitals cannot just be focused on prevention. Vendor supply chain risk management and workforce training. A hospital security program needs to produce the following outcomes however you get it done. Establish compliance, maintain compliance, reduce the number of incidents, reduce the severity of incidents, and drive hospital and patient care continuity. Your hospital is already a beacon of trust in your local community. We understand cybersecurity can feel overwhelming. As you look at all this stuff, just ask yourself these basic questions. Do you have the right people in place? And do you have too many folks, vendors, leading to a lot of management overhead and lack of accountability? If you fix those two things, you'll be the beacon of trust in your community when it comes to PHI, hospital and patient care continuity, at a cost that makes sense, and your leadership and board members will feel in command. Patients deserve uninterrupted hospital operations and protection of their health information. Cybersecurity is a growing challenge. Consider partnering with First Call to help you establish a true cybersecurity program, working with your internal IT department if you have one, or with us as a complete IT cybersecurity and compliance solution for smaller rural hospitals struggling to find internal IT resources. Your community, patients, and providers deserve uptime and security from your hospital. Chris Sellers is our Chief Information Security Officer. You can reach out to either of us for more information.